The next presentation.
We tried to study the patterns of retinal and choroidal neovascularization in type 2 macular telangiectasias. There were no financial interests involved in conducting this study. Macular telangiectasia type 2, as we know, is a disease of the retinal vasculature, which it has been divided into the non-proliferative and the proliferative stages. The non-proliferative stages are the gas and bloody stages 1 to 4, whereas the proliferative stage is the gas and bloody stage 5, which has classically been described to be associated with subretinal neovascular membranes. But is this so characteristic? There have been recent reports suggestive of association of macular telangiectasia type 2 with non-subretinal neovascular membrane patterns of neovascularization. And why is this occurring? So, to study the neovascular patterns and clinical features in the patients diagnosed with macular telangiectasia type 2 in our set of patients was the aim of our study. So we did a retrospective analysis of our group of patients who were diagnosed cases of neovascular type 2 macular telangiectasia, and patients in whom enhanced depth images were of poor quality or were not acquired were excluded. Ultimately, a total of 42 eyes were included in the study, and these patients were further grouped into two categories. Group A included patients with the classical subretinal neovascular membrane, and as well as the patients with silent neovascularization, and whereas group B included patients showing other forms of neovascularization. Now we studied the demographic characteristics, the clinical features, the angiographic features of these patients, and on optical coherence tomography we looked for the dilated choroidal vessels, and the choroidal thickness in these patients was measured using the inbuilt caliper tool of the Heidelberg Spectralis software. Two independent observers noted the findings, and the data was analyzed using Microsoft Excel and the statistical package for social sciences softwares. Uh, Coming to the results, in our set of patients included in Group A, we found the classical subretinal neovascular membrane pattern in 31 eyes, whereas silent neovascularization was seen in 5 patients. Silent neovascularization was defined as absence of neovascular activity, but in presence of a retinochoroidal anastomosis. In our patients in Group B, we found 4 cases of polypoidal choroidal vasculopathy, whereas pachychoroid neovasculopathy and retinal angiomatous proliferation was present in 1 eye each. Coming to the gender distribution, most of our patients within groups as well as overall were predominantly females. So, looking at the comorbidities, diabetes mellitus was more frequently seen in patients in Group A, whereas in only 1 patient in Group B, whereas hypertension was seen more frequently in Group B compared to Group A. The mean age of our patients was higher in the Group B compared to Group A, and the mean choroidal thickness was also marginally higher. However, both these values were not statistically significant. Dilated choroidal vessels were seen in 83.3% of patients in Group B, as against the 55.5% patients in Group A. However, this difference was also not statistically significant. These are few case examples in our study. The first image showing a fluorescent angiography image showing a perifoveal leakage with a corresponding clinical photo showing a pigmentation at macula. The other eye of this patient had a hyper surrounded by hypo pattern characteristic of polypoidal choroidal vasculopathy. The next image is a case of Mactel who presented with hard exudates in the foveal region. This patient was ultimately diagnosed to be pachychoroid neovasculopathy. The third image is the last image is a characteristic hairpin loop seen on indocyanine green angiography with a trapezoid pigment epithelial detachment suggestive of retinal angiomatous proliferation. So, to summarize the results, female gender was more predominant. Diabetes was seen less frequently in Group B, whereas hypertension was more frequently seen. Choroidal thickness was similar in both groups, and the mean age of Group B was higher. And dilated choroidal vessels were seen more frequently in Group B, and the difference was not significant in any of these characteristics. Various studies have indicated the neovascularization in MACTEL originates from the retinal vasculature. However, Zhang et al. In the study of OCT angiography concluded that subretinal neovascular complexes may also be connected to the choroidal vasculature. So, an extension of the neovascular process to the choroidal circulation is probably what we are seeing in our pachychoroid set of patients in group B. Pachychoroid pattern of neovascularization was predominant in our group, and Shablani et al. Had also tried to analyze the choroidal thickness in patients with MACTEL, and the differences in choroidal thickness were not significant in their finding as well. And our group of patients, however, is very small to come to any solid conclusions. Yanuzzi et al. Found similarities between the pathogenesis of retinal angiomatous proliferation with neovascular macular telangiectasia. What they say is that as a compensatory mechanism to perfuse and drain the angiomatous lesion, the proliferation is seen in the deep capillary circulation, and this proliferation extends beneath the retina to form the subretinal neovascular membrane. The patients in RAP are often of a higher age group, and this is consistent with our findings. So to conclude, as MACTEL progresses, an array of changes occur in the retinal and possibly the choroidal vasculature, and the occurrence of pachychoroid features in MACTEL may be yet another unexplored lacuna. And the small sample size was a limitation of our study, and we need further studies to investigate this further, whether any atypical neovascularization is associated with these patients.